I'm Dr. James Kelly, and my practice is known as Kelly Vision Center, and we have offices both in New York City and Long Island. LASIK is a procedure that's done in about 10 minutes for both eyes. It's done without a blade, without scalpels, without needles. It's a highly precise technology that changes the curvature of the front of the eye, which is known as the cornea. And that reshaping of the corneal contour allows people to see very clearly for decades without the need for glasses or contacts. One of the best parts of LASIK is that it's a procedure that takes about 5 minutes per eye. So I tell patients it's unbelievable, but in 10 minutes the procedure is done. During the procedure, there's very little discomfort associated with it. I spend time guiding the patient through the procedure. I verbally coach them. I put anesthetic eye drops in to make them comfortable. Often I'll have one of my assistants hold their hands. So the whole process takes about 10 minutes and has very, very little discomfort associated with it. For a few hours after the 10-minute procedure, they will be in some discomfort. So the best thing for them to do is to go to a dark room and keep their eyes closed for that few hours after the procedure. But usually by 24 hours, most people can resume their normal activities. So the recovery is really rapid, and most people can seamlessly integrate this into their lifestyle. I often get asked, who's a good candidate for LASIK? And we put patients through about 9 different tests to determine their candidacy. But typically there are people between the ages of about 18 and 60, and they have a degree of nearsightedness. And even if they have astigmatism, it can be easily corrected. So I tell patients that almost every prescription can be corrected with LASIK as long as there's no other eye diseases, and we check for that during the consultation. The complication rate with LASIK is very low, and this is something I take very seriously. Dry eye is a very common side effect. It goes away after a few months in almost every case. Light sensitivity is another side effect. And I go over all of these and other side effects in person with them so that they're fully informed as to the risk and benefits and any alternatives they may have. About 99+% of patients see 20/20 or better. Many patients tell us that their vision after laser vision correction is better than it ever was with their glasses or contacts. So a common refrain that I get from patients, they look at me the next day and they go, "Doctor, why didn't I do this sooner?" And I said, I don't know, you have to tell me that. What were you waiting for? As someone who's had eye surgery themselves, to see the technological transformation that's taken place over the last 2 decades is quite amazing. Every year that goes by, the technology gets better, the software gets better, the hardware gets better, and our results get better. They were good 20-something years ago, they're even better now, and I tell patients to please come in and I'll explain to them where we are today.